Ayukui, Nakna, Virginia Hedrick, Shregon Mewamechak. Good evening. My name is Virginia. It's been at least a month since we've been on here with a Facebook Live. And I'm so excited to have two beautiful guests join me tonight. We've had a lot of conversation about how families and elders have decided to be vaccinated or not decided to be vaccinated, how various walks of life have experienced the pandemic. And I'm so pleased to have two Native educators with me tonight to talk about some of their experiences. And so I'll stop and allow you to introduce yourself, and maybe we'll start with you, Melody.
Hey, Young. Tetia Nuhsan Dikyung, Melody George Moore Holiet, Taika Mishling, Nahwaye, Natinu, Nahwaye, Kinchu Suhdai. I'm from the village of Taika-Mishting. I'm from Hupa, the valley, and I'm currently living at the village of Kinchufkut. I am a teacher at Hupa Valley High School. I am 30 years at Klamath Trinity Joint Unified School District teaching Hupa language, 7th as low as 5th grade, 7th grade, 8th grade, 9th grade through 12th grade, English mainly now, with Native American literature and Hupa language as my main classes that I'm helping to get people to move through. And my daughter is now with me teaching at Hupa High School, and so I'll hand it to her.
Hey, Young, Natalie Scott Aholiet. I am also from the village of Takamishting and the village of Metdilting. I have Karuk and Yurok ancestry as well as Quilcut. I've been a teacher now for 9 years. I was in the Bay Area for a little while, and then I came here to Hupa to teach. I got married and I have 2 kids now. One of them is 2 and the other is 2 months as of today. And so just living life at the moment, trying to figure out everything.
Thank you both. And Natalie, I saw that in your bio, 9 years, and even Melody, 9 years and 30 years. I feel like the time has just gone by so fast, but you all probably know that. So I think the first question I want to ask you is just, a little bit about your experience as an educator during this pandemic and what it's been like to navigate for you.
So 30 years, I've experienced many different things in Klamath Trinity Joint Unified School District, black mold, a number of different issues. And I always tell the kids that when choosing my career, I am interested in the fact that, and I like the fact that my job has never been the same on any given day. And I like that. I don't think I could survive as a flagger, not to say that that's a bad job or anything, no, but for me, I have to have, new input, and that's where the people come in. But I'll tell you that phrase that I usually tell the kids was tested during this time of COVID because things were changing so quickly. So the first bout that we had of COVID in 2020 in the spring, and we closed completely down, was the first time that I've had to teach without having kids right directly in front of me. I was explaining to you earlier, Virginia, how that the learning curve for a teacher of my age about all of the electronics and the apps and different things that we were expected to do with our curriculum to make it available on Google Classroom, to make it available, 24/7, video ourselves, and to be able to make those available. I was challenged, and a number of my colleagues at that point decided that at the end of that year that they had had enough, that this was a lot of change, too much change, and didn't come back to the district the next following year. My experience personally then was I was teaching at that point. Usually, you know, at 6 o'clock, you'd come home and you could take off your teacher hood, you know, take off your hat of, that is the teacher. But kids were contacting me, my phone, I made it available for people to contact me. And it was constant throughout the night, actually. So I had to set up a new set of rules. And I told the kids, you don't text me past 9:30, because I do go to bed at 9:30, and I won't text you at 4:30 when I wake up. So there's, for the most part, they have been respectful of that. I know that I had watched a live of yours earlier on about, you know, the impacts of inviting a camera into people's houses, and how that changes the dynamic of the house at that particular moment. And so there's comical things, comical stories. There's some very tragic stories about, you know, that I've heard throughout the news of having that happen, where people are, you know, their daily lives are interrupted. So my daily life is interrupted also. I had to make a home office. This is an older bedroom that I have had to refurbish into making it into a space that's quiet, that I can do lives, I can do my teaching, I can do recordings, lengthy recordings if I'm reading a book or something. I've had to rearrange lots of things, and I imagine the kids also to have, you know, that camera in their house. So that is, you know, technology, one aspect of it, but the other aspect, mentally, it was totally depressing to me to not have that interaction, that live interaction with students that I was so used to in the past 30 years of teaching. Like my jokes that I would say would be just to dead air. It was very depressing on my end. And come to find out later, during that total shutdown that we had, some people would get online with me, but for the most part, this was too much for them. What it ended up being that they liked to do is contact me through my phone. And so there were various apps that I had downloaded that were attached to Klamath Trinity School District, the Remind app, and the best one, because I teach language and I was giving out lengthy, large pictures and recordings of things and movies, was Messenger. And my daughter, I don't have Snapchat or some of those newer ones like TikTok, but my daughter can speak to that, about how she has gotten hold of and taught through some of those apps, other apps, these newer ones. That's different. That's so different, because me on a small screen comes across way different than me in person. And I don't know if I'm as effective. I know I'm not as effective on a small screen as I am face to face. And so when towards the end of that 2020 year, we allowed the kids to come back in modified groups where we could track and keep track of who they were getting into contact with, you know, contact tracing. We had group A, group B. That was actually a pretty optimal size. I've had large groups where, you know, I wasn't as effective either, but that was pretty awesome. I felt we could keep people safe, keep our distance. We could clean the classrooms easily. We could be within the space and be safe. I felt like that was probably the safest. Lately, when we got in, our school is on a reservation. And so the public school minds what protocols that our tribe, the Hoopa Valley tribe, puts into place, since people have to travel onto the reservation and to come to teach or to do business with the school. So the school, the Klamath Trinity Joint Unified School District, was coordinating efforts with the tribe and paying attention to the levels of threat that they had established with their Office of Emergency Services. And so when there was a more opening up of the reservation and we got to come back to school in the 21-22 school year, we got to have a prom, we got to have a graduation that was an in-person graduation. That, even though it was a little scary and there were spikes after that of COVID, I feel like you have to pick and choose the events that you are going to try to uphold in your community, and know that there are consequences from those events. But not having a graduation in person impacted my own children, and impacted them deeply because they felt like they missed out, I guess. And even though it was a virtual ceremony, that was not the same as what we had been building towards all of their 18 years and 12 years of school, 13 years of school. So the mental health aspect is a real thing as a teacher, that you have to balance that. And I feel like the kids that really, really, truly needed me and wanted to be there, and I made myself available for them, I was also putting myself at risk. And I was very mindful of that I have a family of my own. And if I get sick, then there's this, then there's, I'm taking myself out of the game if I'm not being careful. So I made sure that I had my mask. You can say I pretty much bought stock with Lysol, even though our school went with this other brand. Lysol's quick, and you don't have to wipe it off. You just let it lay. I brought my own wipes. I brought my own masks, and I didn't rely on the stuff that they gave me, although I used it as a backup when my stuff ran out.
And man, there's so much to that. And I think about like having grown up in, just downriver from there, graduations are really important, and like how we support our young people as a whole community, like the whole community comes out, whether they have a child or a grandchild there, everybody just comes out. And how important that is as Indian people is something I've been talking about too. Like there are some things that we just couldn't do virtually. Like you have to be in a certain place at a certain time together, sharing space in order for that ceremony to happen. So thank you for really bringing that back. And optimal class size in the pods. Like that's something in education there's been like so much advocacy around, is like reduction of class size. And I think we've seen some of that in the pandemic. Like on the health side, we finally won like long fought battles on telehealth, that like people should be able to have access to a provider, even if they don't have transportation to get there. Natalie, I'm interested in hearing what this has been like from your perspective. And I know your mom shared that you maybe were using some apps that she wasn't, and what that was like for you as also, and the same for you, Melody, like you do have families of your own, and you have, 2 young children doing this.
I forgot to mention in the beginning that I teach a cultural studies class, a couple of different sections of that, and natural resources, a science class right now. And so just thinking about just how this whole thing has affected me and my teaching and reaching students and attaining the goals that I'm trying to accomplish, it's been really interesting. A lot of cultural studies, cultural arts, things like that are very hands-on. It's very like, here's the materials, let's work on it together. basket weaving, necklace making, things like that. And so I found myself having to get really creative. So I do have some experience with different types of apps and different types of just with computers in general, video making and things like that. And so I tried to use that to the best of my ability to try to really engage the students in the ways that would best reach them. And sometimes I really wasn't sure if I was fully engaging all of my students, right? That was kind of a bit of uncertainty that I felt at all times being a teacher during this pandemic. And so just a few examples of some things that I would try to do. One aspect was that I feel like I didn't really know a lot of my students, and the students didn't really know me, right? And so I was trying to figure out what are some silly ways that I can put parts of my personality out, right? Or encourage other teachers to do so. And so one thing we tried was a TikTok where we, it was real simple, short videos where we just kind of introduced ourselves and then we showed something kind of interesting about ourselves. So like me, for example, I like to play the drums. And so I was playing the drums on the TikTok video. And so things that like, if you're trying to get to business and straightforward on your Zooms and whatever, you might not necessarily get to share. And so I found myself accepting and asking for friend requests for different students more so than I normally would with like Instagram and Facebook and things like that, because just accessing the students was hard, right? And so the face-to-face wasn't happening at all. And sometimes with the phone call, you don't necessarily get people that want to answer the phone. And so like Instagram was like a less threatening way to try to get a hold of a kid, or Snapchat, right? Just a lot of different ways that I normally wouldn't necessarily try to get a hold of my students. But with the, like Melody was saying, with the mental health aspects, we often found ourselves worrying about our students. And if we didn't hear from them within X amount of time, we would worry, right? Because we all were kind of feeling it, right? There was a heaviness that we all needed to deal with. And so just really getting creative and then finding somebody on Facebook that knows this person so that I could get a hold of this kid, right? Like it was interesting for a while there.
Thank you, Natalie. This is Virginia. I got booted on my computer, so I'm on my laptop. Always a backup, but you guys know that from living through this. So I think, you know, I'm thinking, my mind is like swirling in so many directions of things I didn't think about. You know, obviously as a parent, right? Like I've had 5 kids living through this pandemic, and sort of being on the parent side of education has been really different. And something I think I've widely acknowledged in my family is, you know, I live in Sacramento. And so access to high-speed internet happened within days of the pandemic. I was able to be like, whoop, we need new internet. We're not all going to be able to stream at the same time. And sort of watching family and friends on reservation and more rural areas, the pickup was a lot slower, like months slower, to get families connected, and some families never connected. One of the questions I wanted to talk a little bit about with you guys is vaccinations, and what that has, if anything, changed for you as an educator in the classroom, and what it means for your students when they enter the class, vaccinated or not vaccinated. I can share a little bit of the data. American Indian and Alaska Native children in California are lagging behind all other children in terms of vaccination. Our 12 to 17-year-olds, only about 50% are that are eligible are vaccinated. And in the age group 5 to 11, that drops to 30%, compared to sort of the state average of all kids in the age range 12 to 17, it's about 70%. And for 5 to 11, it's really closer to 50%. So youth in general, school age children in general,
we're not seeing that 70 to 90% fully vaccinated rates that we're seeing in adults, but particularly among our American Indian school-age children are particularly vulnerable. And so I wanted to, I think, ask you about your decision to get vaccinated as a teacher, as a mother, and what that means for you in the classroom, and if these are conversations that students are having.
I'll answer as a mother and a grandmother first. So my children, I tallied them last night to make sure that I had all the data correct. So out of the 8 children that have come through my household, I have 3 that are team Pfizer, and I have 5 that are Moderna. And I understand now that you can mix those, and so they are. I did not make that choice for them. That was pretty much made by the timing of when certain shots were available. The first shots available were the ones they went with. But then looking back on it, I felt comfortable with that. I myself am Moderna, team Moderna, and I felt comfortable with the fact that they weren't all the same shot. In my own family, also, I have some family members that went with the Johnson and Johnson one shot. I call that the tag them for the if they're wild and you can only get them for a little bit of time, tag them with the one shot. That's what that one is in our family. But I felt comfortable with them being in and amongst the different ones available, because I felt like if I put all my eggs in one basket and something went wrong, that I would be covered, if that makes sense. So I was thinking like that. I was thinking back to past pandemics that I know, because I teach, at one point I taught local history, and knowing that we had past pandemics and we got hit hard in our community with tuberculosis, with smallpox, with diphtheria, all those, whooping cough, all of those that you get your childhood vaccinations that your baby gets vaccinated with, that there's a reason why we get those. And so knowing and having that educational piece behind me, I was very comfortable with getting the shot and encouraging my children and grandchildren to get the shot. Now, I have now currently one grandchild that is school age. So, and one is transitioning into preschool. So these shots are very important.
So for me in particular, the vaccines kind of came during times, I think of mostly as a mother, like my decision in this process. And so with the first vaccine coming out, I chose to get vaccinated at a time when I was breastfeeding my first child, and I worried a little bit about there being some risk with that, but then I felt good after looking through some of the data, asking some questions, talking to my doctor, that would be just fine. And so, and actually maybe even promoting more positive health outcomes for my son, because of the idea of passing antibodies possibly to him. And so I decided to get vaccine as soon as I could, basically. Being a teacher and being around many different students from many different households and different families, I felt also that being vaccinated would be my best chance at not getting sick myself or not getting severe illness. And so that has been big for me. I've also heavily encouraging mask wearing and things like that in my classroom. And I've been very happy with how respectful the students have been overall with just my choice, even after the mandate was lifted, right, to keep masking and suggesting that they mask, and also just the respect that they had for each other on their choices. And so that whether it be mask wearing or vaccination, the kids felt kind of comfortable talking about it, I found. And I didn't find that people were really negative about it at all. And so that was really good.
I really appreciate your attention to respect as being sort of like what this is about, like being respectful to each other. And that was one of my later questions is, what are the COVID protocols that, you have in your classroom? So Melody, you talked about making sure that they're really clean and keeping areas really sanitized and mask wearing, having open and honest conversations based in what we know about science in the vaccines. And then the other thing, Natalie, that you said that I think is really important is, any healthcare decision that people make should be made thoughtfully, right? Like when you're making a decision about, having a child, if you're making a decision about something for your child, if you're making a decision as a human, as in healthcare, it's important to be thoughtful about that and go to the sources that we trust and that we know, and to carefully make those decisions. And I think that's something that I think people take for granted, that they think that so many people just got the vaccine without thinking about it. And I think in Indian country, there was a bit of a pause for a minute to really contemplate, is this right for our communities, and how will it help us navigate in ways that might be more safe. And earlier, Melody, you and I were talking about sort of what would be recommendations to as a teacher to your students' families on how they navigate in their personal lives, right? Because this is the other way, something that I've been sharing with a lot of people as like Indian people, we've long known that we're all connected, and your actions will impact me. How much you fish, what you do will impact me and my family. And I think that sort of belief and way of knowing about how we're connected is deeply understood throughout the country in ways that people didn't imagine that we're connected. That a cruise ship docking in the San Francisco Bay that brings very sick people into California will impact all of us. And we're still sort of living through some of those effects. So you mentioned, Melody, something about how parents might navigate and how some of those choices can be made, or your recommendations for how people choose. And I think you brought up like graduation being at a risk worth taking, like a well-calculated, a well-planned for risk, right? And what that looks like.
So I teach freshmen, I teach a sophomore English class, and the most interesting conversations this past year were happening in my Hoopa language classes, because I have a mix of 10th through 12th graders. And we do a mixture of stories, language, and the concepts always come up. People want to know, well, what's happened in the past? What has happened in the past in regards to pandemics? And so that is a discussion. And I start with family trees. And we start with the family trees that are known, the people that are on the branches that are directly, that they're a direct descendant of. But what they don't know and what they don't understand, and I oftentimes have to point it out, is that for every one of those people in Indian country, there were how many others that didn't make it. And so talking about cemeteries, talking about, well, on Memorial Day, who goes and puts flowers on whose cemetery? And do you know who's in that cemetery? And whose responsibility is it? Because that is I'm not the one that inherited that responsibility in my family. That's my sister and my mother and my aunties. And they visit and they make sure that they're taken care of, and so that is an inherited responsibility. And so those people are the people that these kids need to talk to find out how many people did not make it. And so that might be number one, helping you make a decision, looking at the percentage in your own family of how many natives died. So I made it real, and we did in Native literature, a graph of all of California natives, the population estimate pre-contact, and then there was a decline, and then at the lowest point, which is like the 1910 census, there were it's the 90 percentile, there's like 90% of natives, and depending upon what sources you're using, those sources show that there was 15,000 natives left at the highest estimate in California in 1910. For what reason? And there's genocide, there's pandemics. Let's talk about those pandemics. In my own family, and I tell stories in native literature, and I tell stories in Hoopa language about my own family and the family tree. And there's pictures in my room of my relatives, and one of them is of Awak Mary Socktish, and we talk about her and her hiding her son from the boarding school truant officer, and he didn't go to school. She hid him from the boarding school because her other, and I just looked at the document because we had a funeral recently and we had to find out where the places were open in our own family cemetery, who was in there. All of her other children were in that cemetery and I wasn't even aware of these other children that had passed because of past pandemics. The oldest that I didn't even know about made it to 17, and then there was this pandemic. So these family stories are real. That then we're talking about, okay, well, how would that change our community then? How would that change our community? So the kids how would that change your family? So the kids had to think about, well, we distrust the school. The school is where you go to die. Well, yeah, and that was all happening with the boarding school children being, the burials were being uncovered. And so we were talking about that. And we were talking about, well, how would that then change your family in regards to a celebration of somebody who did make it through school? The 8th grade graduation is extremely important. Yay, we made it. And it makes it that much more important because you look at the people that didn't make it in your cemetery. So then, it unlocks a lot of, oh, that's why it looks like that. That's why we have this distrust of the healthcare system, because there's all these answers that happen because of the storytelling that happens. Decision making then is a whole other separate thing. How do you make a decision? So we go through the T tables. In your own family, do you have underlying conditions that you need to be aware of, that this shot is going to exacerbate those conditions? Yes, in my family, we have those. We have people that have survived polio, and if they get this shot, oh my goodness, it's going to mess them up. So we need to get the shot because that person can't get the shot. We had to make decisions like that. When we're sick, then we have to do our own contact tracing. And so when Natalie was talking about, she lives 30 feet from me, and there were times because I couldn't babysit because I couldn't guarantee that I didn't have COVID. And so when she talks about I was on my own, she's talking about I could wave at her through the window and wave at the baby through the window. That was hard. That was tough. So when we know how to, when we've gone to go do something, and it's an important thing that we did, a graduation ceremony that we attended, then we kind of go to our own little pods and we kind of hang out there for a little while until we figure out, are we going to test positive or are we going to be okay? 5 days. And then we do a lot of testing. I have COVID tests. You want a COVID test? Come to my house. I got some, right? And we share that information, and the minute that somebody has a sniffle, then we get to the root of that. Is this COVID, or is this just the Humboldt crud, right? Is what's going on. So we're more aware of our own bodies, and we're more aware of the decisions that we're making, because we know that they are going to affect in real time our own immediate family. And so the kids were having those same discussions in my classrooms, and they were saying things like to each other, why don't you go get the shot? Because then we can have a football season. That was a real comment. And then because we tested our athletes, and it's in the contract, we oftentimes had information that the elementary school didn't have, but we had the same families. And so we would pass that information on and say, hey, you got to watch out, because this guy tested positive. And then sure enough, they got tested, and then we were on top of things like that. So the school acted like a very important healthcare provider in some cases for a lot of people. I know we provided food in those early days. I was helping to deliver boxes of food, and then California got their crap together and we got the cards, right?
Yeah.
But I didn't mind delivering food because I got to talk to people. It was a good way to answer questions and get news out to people.
Well, that's one thing I think in the pandemic that people, I hope, walk away realizing just how central our teachers are to making the whole world go round, right? Like it's so much that we rely on teachers for in our education system. And so just appreciate you both so much for the important roles that you play in our local community and your families and our ceremonial communities. Just appreciate the conversation tonight. I wanted to just give you a minute if there's anything else that you wanted to share with folks. Please feel free to. That was sort of my questions, was about navigating the pandemic as an educator, decisions around being vaccinated, sort of impacts of community behavior on your classroom. And yeah, I wanted to just leave a few minutes if there's anything that you wanted to share in closing.
I wanted to talk about currently, the conditions currently, because we're riding these successive waves of different variants, I guess, and decisions that people make in regards to what would be important for their family. Now, Disneyland is not so important right now, but graduations are very important. That is something that, for the mental health of my own children, the graduations were important. We had a ceremony recently. That was an important event, a flower dance ceremony for my daughter Trinity. And that coming of age ceremony was important, not just for her, but for my immediate family and then the extended family, to have that happen, because we postponed it during the first COVID onslaught. And then we figured out what we were going to do as a family for our high ceremonies, our jump dance and our deerskin dance. We ended up having those with COVID protocols in place, which was something we hadn't had to do previous to that. But then it made me think about a lot of different things in regards to our own response as Native people to these pandemics of past. I do medicine for these ceremonies. And so that meant that I fast, and that meant that I do isolation, and it meant that I eat alone. And so I think about a lot of those things put into place, and I'm wondering, were they previously there, those protocols of eating alone and not and being isolated, or is that a reaction of a previous cultural event in regards to the a previous pandemic? They worked, okay, because being isolated for 10 days, that was a COVID protocol. A lot of people made mention of the fact that being isolated in that first event back in 2020 was very strange for them. They had never had to be socially isolated before. But then there were a lot of the girls that had had ceremonies and flower dances, and they said, it's just like that, And the fact that it went on for a long time is not the same thing, but that they were prepared mentally for something like that. Whereas a lot of our people that had not had a ceremony or did not have an event like that to fall back on, they had an adjustment issue, I guess, in order to go forward in a way that was good for them mentally. They had to readjust what they were doing and thinking. So when you make these decisions as a family about which of these things are going to be important, make them very carefully, so that, because that they are going to impact other people. What your pod is not necessarily, when you start to write it out, what your pod actually is. That's what we found out, because when we were thinking, oh, we can take our mask off with grandma, everybody was taking their mask off with grandma. That's not good for grandma. So our pods are not just our pods. We shared space with a lot of different people. So just know that. Know that the future holds more COVID variants that will be coming. And so we're going to be riding these waves. So what is your personal hygiene like? And that should include something to mitigate, your hand washing, your mask wearing, your social, 6-foot distance, what are you doing to make sure that you're protecting yourself? If you're not protecting yourself and you're counting on these new antivirals, I was explaining that you don't know your body like you think you know your body. These antivirals, the shots themselves, the antivirals, they come at a cost, and sometimes some underlying issues may be there. And it's a gamble. But if you're counting on just one particular thing, like a shot to protect you, and you're not washing your hands or you're not wearing your mask, that's not going to be as helpful as if you're doing all of the things that you should be doing. So it means that you have to communicate more with people. If you're going to do ceremony, you have to communicate openly with people. You have to be prepared for somebody not knowing that they have something. If they're going to attend your event, what are you going to do? How are you going to handle that? What is, after the event happens, what is your communication going to be with other people? So you just have to think about those things, and some people are learning how to do that. So
yeah, thank you. I mean, I think you just really absolutely nailed it. We're hearing, folks should be hearing, if you're watching anything COVID, as soon we will transition to what is known as an endemic. An endemic means that we're living with it. We're living with an infectious disease among us. And I think some of the things that you mentioned is, calculating your risk, knowing what your risk scenario is, every situation you walk in. And we do have more tools in our tool belt than we had in March 2020. We have vaccines, we have masks, we have hand sanitizer, we have ways of mitigating, ways of gathering safely, as safe as possible, for ceremony as we get together, and trusting our community that folks are really staying home if they're not feeling well, that folks are reaching out to their networks if they've exposed other people, are all really important pieces. So yeah, just thank you so much. And Natalie, anything you want to share in just in closing?
Yeah. So in thinking about all of this and kind of a little bit of what Melody said and just my take on all of the different steps that you can take to protect yourself and others, I feel like for me personally, so much about my decision making, so much about me choosing to still wear masks in public and go when I go to Costco and things like that, and limiting exposure to large groups of people and things like that. So much of my decision making is about me feeling like I want to respect others, like I want to respect the health of those around me. And so me trying to do my part to limit my, first of all, exposure, but then also if I'm possibly exposed, limiting my part in spread, I guess. And so much of my decision making is about my respect for other people, my respect for elders, my respect for the students in my classroom, my respect for my family. And so doing everything I can to help lower risk for other people. And so it's not about people telling me that I have to do these things as much as it is about me wanting the best for everybody. And so I find myself doing whatever I can, right? Testing when I can, wearing my mask when I can, and getting vaccinated and getting my family vaccinated. And that's important to me. That's important. I care about my community. I want the best for them. And so that's really what it's all about for me. And so.
Well, Clau, thank you both for spending your Wednesday evening with us. And thanks for those who joined. I saw a number of people on and off during the live. So thank you. And yeah, just appreciate your time, your wisdom, your knowledge, and sharing virtual space with me tonight. Taki Kemnewitchik.